Hello, this is Fowler Guide International. I'm Dr. Stuart Fowler, and I'm here with Laura from Texas. And this clinic is set up to treat women that have conditions of altered vaginal microflora. And it can result in a number of different symptoms depending on the innate sensitivity of the vulvar tissues, particularly the vestibule, which is made out of Endoderm compared to the rest of the vagina and vulva, which are made out of Ectoderm. But I wanted to ask Laura, because she's just like so many of my patients. She's come from quite a distance, and she had seen a number of doctors before, and she's well educated. And I want to ask her, what did it feel like when you first saw me? What was your impression?
I was relieved to finally be in an expert's hands. I had thought that I was in expert's hands. I had been with my gynecologist in Texas for 6 months trying to figure this out when he finally threw his hands up and said, "I'm sending you to infectious disease." And infectious disease partnered me with the woman in their clinic that specializes in vaginal infectious disease. And I felt kind of like a lab rat because they were just trying all these different systemic medications on me that were actually quite scary. And I was really losing hope when I got a phone call from Dr. Fowler, because I had found his website and thought maybe he can help. And when I found his website and logged in and scheduled something, gave me a call on a day I was feeling really unhopeful. And he said, I think we might be able to fix you. And so I flew down here, and I immediately knew when I started to talk to Dr. Fowler that he had spent his life's work in an area that's very, very tricky, and he gave me hope in an area where other doctors were very skeptical to give me hope because they knew how tricky my case was and that it's really difficult to help women with these symptoms.
Laura, what symptoms were you having? And how was it affecting your lifestyle?
I didn't want to wear pants, underwear. My vagina hurt so bad, but I didn't have any of the discharge and the telltale signs, and I couldn't have intercourse. I couldn't exercise. I was at a complete loss.
How were your doctors down in Texas treating you?
Well, at first, my regular gynecologist would just run the lab work that he could run, which was very limited on what he could actually test for. And then infectious disease ran a more extensive panel, and then we would get back a rare fungal that they would think, well, okay, we found it now. And so they would treat me with oral, and oral medication didn't work, and so they actually put a port in my arm and gave me an IV medication that was absolutely awful. They tried 2 different rounds of that. And I would go back, and we were just chasing after the next infection, and I felt like I had a UTI. And then we would test for UTI, and that would come back negative, and it was almost like they didn't feel like they believed how much pain I was in. And in fact, the infectious disease vaginal expert, she told me, she said, "You know what? Sometimes I just have women like you forever." And I said, "Nope, not me. That's not going to be me."
Well, Laura, I've seen a lot of women that have come in and had Vulvodynia for 3 years, 5 years, 7 years, 15 years, 20 years, 30 years, and they've been living with it for a long time without answers and solutions. And the interesting thing about vulvodynia is often there is some yeast element present because the secretions have changed in the vagina, and it makes it more conducive to grow yeast. And in your case, it was growing Candida krusei twice, which is one of the common of the uncommon strains called non-albicans yeast. And so patients will wind up getting looked at, having something like that found, having the treatment directed to that, and it doesn't work. That's because it's not the underlying problem. It's secondary to the underlying problem. And so what was your feeling after you met with me for the first time? Did you have confidence in what I was telling you, and why would that be?
I absolutely had confidence in that. I have never seen someone give such a thorough packet, actually, as what you gave me. It was a relief to walk home with I don't know how many pages are in that packet, 20, 30, 40, and to have a protocol that told me exactly, step by step, what to do. This is your regiment. And you're going to do all of these things, and we're going to check back in this many months, and you have the lab to be able to actually track what is going on. And so I felt very confident after I left your office, and hopeful and prepared to follow the protocol.
What we do here at Vagina International, we actually fix the altered flora present in the vagina in these patients, and it's what's giving rise to the vulvodynia. And once we get those secretions to go back to neutral, then their symptoms start to abate and then ultimately resolve. But it is a process that requires a good deal of time. Most of our patients require over a year to get fully fixed, and then some women require even into a year and a half, 2 years to get fully resolved of their symptoms. How do you feel now? How are you doing?
I'm doing so much better. My life is pretty much back to normal. There's sometimes when my vagina is a little too sensitive, and we are almost at the right formula for my vagina, but I have my sex life back. I have my exercise life back. I am just so grateful. So grateful.
Laura, thank you for visiting us here at Vagina International, and we're grateful that you are doing well.
Thank you.